Must-have supplements for seniors. Support your health as you age. Welcome back to Health Every Day. As we age, maintaining our health becomes more important than ever, and supplements can play a key role in supporting our well-being. But with so many options available, it's easy to get overwhelmed and not know where to start. In today's video, we'll focus on the must-take supplements for seniors, the essential vitamins and minerals you should be including in your daily routine to boost your heart health, support your bones and muscles, and keep your brain sharp. From vitamin D to omega-3 fatty acids, we'll walk you through the supplements that can make a real difference in your health as you age. Don't forget to like, comment, and subscribe to Health Every Day for more health tips. Must-take supplement 1. Vitamin D. Vitamin D is one of the most important supplements for seniors, playing a crucial role in bone health, immune function, and overall well-being. As we age, the body's ability to synthesize vitamin D from sunlight diminishes, and the dietary intake often becomes insufficient. This deficiency can lead to a range of health issues, particularly related to bones, muscles, and the immune system. Why vitamin D is essential for seniors. The primary role of vitamin D is to help the body absorb calcium, a vital nutrient for maintaining strong bones. As we age, our bones naturally become more fragile, and maintaining bone density is crucial to prevent fractures, osteoporosis, and falls, issues that are particularly dangerous for older adults. Without sufficient vitamin D, the body struggles to absorb calcium properly, leading to weakened bones and an increased risk of fractures, even with minimal injury. In addition to supporting bone health, vitamin D is essential for maintaining a healthy immune system. Older adults are more susceptible to infections, and having adequate vitamin D levels can help boost immune function, reducing the risk of illnesses like the flu and pneumonia. Vitamin D also plays a role in regulating blood pressure, reducing inflammation, and supporting cardiovascular health, all of which are crucial for seniors looking to maintain strength and vitality. Scientific explanation: the importance of vitamin D. A deficiency in vitamin D is linked to a variety of health issues, especially in older adults. According to research published in the Journal of Clinical Endocrinology and Metabolism, low vitamin D levels are associated with a higher risk of fractures and falls. In fact, seniors with inadequate vitamin D levels are more likely to experience bone fractures due to weakened bones. One large study found that taking vitamin D supplements significantly reduced the risk of falls by improving muscle function and strength, thus helping prevent the injuries that come from falls. Vitamin D is also crucial for maintaining muscle function. The muscle-strengthening effects of vitamin D have been well documented. A study published in the American Journal of Clinical Nutrition found that older adults with low vitamin D levels had reduced muscle strength and were more prone to experiencing physical disability. The research suggests that vitamin D supplementation can enhance muscle strength, balance, and overall physical performance in seniors, which is vital for preventing falls and maintaining independence. Moreover, research indicates that vitamin D has anti-inflammatory properties, which is important for reducing chronic inflammation associated with age-related diseases such as arthritis and cardiovascular disease. Chronic inflammation can accelerate muscle breakdown, joint pain, and mobility issues, making it even more important for seniors to maintain adequate vitamin D levels. How to ensure adequate vitamin D intake? There are several ways to ensure you're getting enough vitamin D. The body produces vitamin D naturally when exposed to sunlight, but as we age, this process becomes less efficient, and many seniors have limited sun exposure due to lifestyle or geographic factors. This makes vitamin D supplementation particularly important. Vitamin D supplements. The most direct way to ensure adequate vitamin D intake is through supplements. The recommended daily allowance, RDA, for vitamin D varies by age and health condition, but for most adults over 65, the RDA is between 800 to 1,000 IU international units per day. Vitamin D3, cholecalciferol, is the preferred form of supplementation as it is more effective at raising vitamin D levels in the blood compared to vitamin D2, ergocalciferol. Always consult with your healthcare provider before starting supplementation to determine the right dosage for your individual needs. Sun exposure. While sunlight is an excellent natural source of vitamin D, it's important to balance sun exposure with skin protection. Seniors with limited sun exposure can struggle to produce enough vitamin D, so it's essential to get sunlight regularly, but safely. Spending 10 to 30 minutes outdoors a few times a week, depending on your skin type and geographic location, can help. However, prolonged sun exposure should be avoided to prevent the risk of skin cancer. Vitamin D-rich foods. Vitamin D can also be obtained from certain foods, although it's difficult to meet daily requirements through diet alone. Fatty fish, such as salmon, mackerel, and sardines, are rich in vitamin D, as are fortified foods like milk, orange juice, and breakfast cereals. Egg yolks and beef liver also provide small amounts of vitamin D. Including these foods in your diet can help support your vitamin D intake, though you may still need supplementation, especially if you have limited sun exposure or specific health conditions. Monitor blood levels. For seniors, regular blood tests to check vitamin D levels are essential, especially if you have osteoporosis, a history of fractures, or other bone-related issues. Your healthcare provider can help determine if supplementation is needed and what dosage is appropriate. Many people have low vitamin D levels without realizing it, as symptoms are often subtle and can develop over time. Risks of deficiency and excess. While vitamin D is essential for health, it's important to strike a balance. Too little vitamin D can lead to weakened bones, muscle weakness, and a higher risk of fractures. On the other hand, excessive vitamin D intake can cause toxicity, leading to hypercalcemia, high calcium levels in the blood, which can result in kidney damage, nausea, and confusion. This is why it's important to consult a healthcare provider before starting vitamin D supplementation, especially if you're taking other medications or have underlying health conditions. Must-take supplement 2. Omega-3 fatty acids, fish oil. Omega-3 fatty acids, particularly EPA and DHA, are essential fats that offer a wide range of health benefits. For seniors, these healthy fats are crucial for maintaining heart health, reducing inflammation, and improving cognitive function. As we age, the body's ability to efficiently process fats decreases, and many seniors are not getting enough omega-3s from their diet. Supplementing with omega-3s can support cardiovascular health, enhance brain function, and protect against the natural decline in muscle mass and strength that occurs with age. Why omega-3 fatty acids are beneficial for seniors? Omega-3 fatty acids are most commonly found in fatty fish, but they can also be found in plant-based sources like flaxseed, chia seeds, and walnuts. However, many seniors struggle to consume enough omega-3s from food alone, which is why supplementation is often recommended. Omega-3s play an essential role in reducing chronic inflammation, which is a key factor in the development of many age-related health issues, including arthritis, cardiovascular disease, and cognitive decline. Chronic inflammation contributes to the degradation of muscles and joints, weakening mobility and reducing strength. By lowering inflammation, omega-3 fatty acids help protect against these issues, maintaining leg strength and overall mobility. Furthermore, omega-3s are crucial for heart health, which becomes even more important as we age. Studies have shown that omega-3 fatty acids can help lower blood pressure, reduce triglyceride levels, and decrease the risk of heart disease, a leading concern for seniors. By improving cardiovascular function, omega-3s help maintain the strength of the heart and circulatory system, ensuring that the muscles, including those in the legs, receive the oxygen and nutrients they need to stay strong and functional. Scientific explanation: the role of omega-3s in health. There is strong scientific evidence supporting the health benefits of omega-3 fatty acids for seniors. One of the most significant effects of omega-3s is their ability to reduce inflammation. Chronic inflammation can weaken muscles, impair recovery, and contribute to joint pain. By taking omega-3 supplements, seniors can help alleviate these symptoms and promote joint and muscle health. A study published in the American Journal of Clinical Nutrition found that omega-3 fatty acids, especially DHA, are effective in reducing markers of inflammation and improving muscle function in older adults. The study revealed that seniors who took omega-3 supplements experienced increased muscle strength and better mobility, which is crucial for maintaining leg strength and reducing the risk of falls. In addition to reducing inflammation, omega-3 fatty acids have been shown to play a protective role in brain health. Omega-3s, particularly DHA, are important components of brain cells and have been linked to better cognitive function and a reduced risk of neurodegenerative diseases such as Alzheimer's. A study published in the Journal of Aging Research and Clinical Practice showed that seniors who consumed higher levels of omega-3s had improved memory and cognitive abilities compared to those with lower omega-3 levels. This is especially important for seniors who want to keep their minds sharp and prevent the cognitive decline that often accompanies aging. Omega-3s also support vascular health by improving blood flow and reducing blood clotting, which reduces the risk of heart attacks and strokes. Improved circulation helps deliver oxygen and nutrients to muscles, including those in the legs, allowing them to function optimally and recover from physical activity. Praktiske tips for omega-3 supplementation. Omega-3 supplements are a simple and effective way for seniors to ensure they are getting enough of these healthy fats. Here are some practical tips to incorporate omega-3s into your daily routine. Choose high-quality fish oil supplements. When choosing omega-3 supplements, look for high-quality fish oil that is purified to remove heavy metals and toxins. Omega-3 supplements are available in liquid or capsule form, and it's essential to choose a product that provides sufficient amounts of EPA and DHA. For seniors, a daily dose of 1,000 to 2,000 milligrams of combined EPA and DHA is generally recommended. However, always consult with your healthcare provider to determine the right dosage for your specific health needs. Consider plant-based alternatives. If you prefer plant-based sources of omega-3s, look for supplements containing algae oil, which is rich in DHA and EPA. Algae oil is an excellent alternative for those who are vegetarian or allergic to fish. Plant-based omega-3 sources like flaxseed, chia seeds, and walnuts are also beneficial, though they primarily contain ALA, a type of omega-3 that the body must convert into EPA and DHA. Incorporate omega-3 rich foods. In addition to supplements, you can increase your omega-3 intake through diet. Fatty fish such as salmon, mackerel, sardines, and herring are excellent sources of DHA and EPA. If you prefer plant-based options, include chia seeds, flaxseed, hemp seeds, and walnuts in your meals. Adding these to smoothies, salads, or snacks can boost your omega-3 intake. Check your omega-6 to omega-3 ratio. In addition to increasing omega-3 intake, it's important to reduce your consumption of omega-6 fatty acids, which are found in processed vegetable oils, nuts, and seeds. A high ratio of omega-6 to omega-3 can promote inflammation. Aim to balance your omega-6 intake with sufficient omega-3s to support overall health. Monitor your blood lipid levels. If you're taking omega-3 supplements for heart health, it's a good idea to have your blood lipid levels checked regularly. Omega-3s can help lower triglycerides and improve cholesterol levels. But it's essential to track your progress with regular blood tests to ensure you're achieving the desired results. Risks of excessive omega-3 intake. While omega-3s are essential for good health, it's important not to exceed the recommended dosage. High doses of omega-3s, greater than 3,000 milligrams per day, may increase the risk of bleeding or interfere with blood clotting, especially for seniors who are on blood thinners. Always consult with your doctor before starting omega-3 supplements, particularly if you have any existing health conditions or are taking other medications. Must take supplement 3, magnesium. Magnesium is a vital mineral that plays a crucial role in numerous bodily functions, especially for seniors. It supports muscle function, bone health, energy production, and cardiovascular health. As we age, magnesium levels in the body can decrease, and many seniors are found to be deficient in magnesium. Ensuring you get enough magnesium can improve leg strength, prevent muscle cramps, and help maintain overall health. Why magnesium is beneficial for seniors. Magnesium is essential for more than 300 enzymatic processes in the body, making it an indispensable nutrient for seniors. One of its most important roles is in muscle function. Magnesium helps regulate muscle contractions and relaxations. Without enough magnesium, muscle cramps, spasms, and weakness are common, particularly in the legs. Muscle cramping is a frequent complaint among seniors, especially at night. Research has shown that magnesium deficiency is often linked to this issue. Adequate magnesium intake helps improve muscle relaxation, reducing the frequency and severity of cramps. Magnesium also plays a role in nerve function and energy production, ensuring that muscles receive the necessary signals to perform tasks and recover after activity. Magnesium is also vital for bone health. It works alongside calcium and vitamin D to maintain bone density and prevent the onset of osteoporosis, a condition that makes bones brittle and prone to fractures. Magnesium helps with the absorption of calcium into the bones and aids in the regulation of calcium levels in the bloodstream. With osteoporosis being a significant concern for seniors, magnesium plays a protective role in maintaining strong, healthy bones. Scientific explanation: the importance of magnesium for seniors. Several studies have highlighted the importance of magnesium in preventing muscle weakness and improving leg strength. A study published in the Journal of Clinical Endocrinology and Metabolism found that magnesium supplementation improved muscle function and reduced muscle cramps in older adults. The study revealed that magnesium deficiency could significantly impair muscle function, leading to muscle weakness and fatigue. Ensuring adequate magnesium intake is one of the most effective ways to prevent muscle cramps and improve strength, especially in the legs. In addition to supporting muscle health, magnesium helps regulate blood sugar levels, which is especially important for seniors who are at risk of diabetes. Research in the American Journal of Clinical Nutrition indicates that magnesium supplementation can improve insulin sensitivity, helping to reduce the risk of type 2 diabetes. Stable blood sugar levels are essential for preventing muscle breakdown and promoting muscle recovery after physical activity. Magnesium is also crucial for cardiovascular health. It helps regulate blood pressure and ensures that the heart and blood vessels function optimally. Studies show that magnesium deficiency is linked to an increased risk of hypertension, high blood pressure, and cardiovascular disease. Magnesium helps relax blood vessels, reducing strain on the heart and improving overall circulation, which is essential for healthy muscle function, especially in the legs. How magnesium supports leg strength and mobility. Magnesium helps maintain leg strength by preventing muscle cramping and promoting proper muscle function. For seniors, muscle cramps can limit mobility and reduce leg strength, making it harder to perform daily activities. Magnesium supplementation helps alleviate these cramps, improving mobility and strength. As a result, seniors can move more freely, preventing falls and maintaining independence. Magnesium's role in bone health also directly impacts leg strength. By supporting calcium absorption and promoting healthy bone density, magnesium helps reduce the risk of osteoporosis and fractures, which are particularly dangerous for older adults. Strong bones are essential for supporting muscles and joints, and magnesium ensures that bones stay strong, reducing the risk of falls and injuries. Additionally, Magnesium's ability to regulate blood sugar levels helps preserve muscle mass and strength. Since magnesium aids in glucose metabolism, it helps ensure that muscles have access to the nutrients and energy they need to perform optimally. This makes magnesium a key player in preserving leg strength as seniors age. Practical tips for magnesium consumption. Getting enough magnesium is crucial, and there are several ways seniors can incorporate it into their daily routine. Magnesium supplements. If you're concerned about magnesium deficiency, supplementation is a convenient and effective option. The recommended daily intake of magnesium for adults over 65 is around 300 to 400 milligrams. Magnesium citrate and magnesium glycinate are two highly bioavailable forms of magnesium that are easily absorbed by the body. Always consult with your healthcare provider before starting a magnesium supplement to determine the right dosage for your individual needs. Magnesium-rich foods. Magnesium can also be obtained from dietary sources. Foods like leafy green vegetables, spinach, kale, nuts and seeds, almonds, sunflower seeds, whole grains, brown rice, oats, legumes, black beans, lentils, and avocados are excellent sources of magnesium. Including these foods in your daily meals can help you reach the recommended magnesium intake without relying solely on supplements. Magnesium oil or topical application. For those who suffer from muscle cramps, magnesium oil or a magnesium cream applied directly to the skin can help provide relief. Some studies suggest that topical magnesium application can be just as effective as oral supplementation in reducing muscle cramps and improving muscle relaxation. Magnesium and calcium balance. Magnesium works best in conjunction with calcium, so be sure to include both in your diet. While calcium helps strengthen bones, magnesium ensures that calcium is properly absorbed and utilized by the body. You can find both calcium and magnesium in dairy products, fortified plant-based milks, leafy greens, and nuts. Monitor your magnesium levels. Regular blood tests can help monitor magnesium levels, especially if you're concerned about deficiency or have underlying health conditions. Your healthcare provider can guide you on the appropriate steps to correct any imbalances. Risks of excessive magnesium intake. While magnesium is essential for health, excessive intake can cause adverse effects. Taking too much magnesium can lead to diarrhea, nausea, and abdominal discomfort. In severe cases, excessive magnesium intake can result in hypermagnesemia, a condition that can cause low blood pressure, irregular heartbeat, and respiratory issues. To avoid these risks, it's important to stick to the recommended dosage and consult your doctor if you're considering high-dose supplements. By maintaining proper magnesium levels through a balanced diet or supplementation, seniors can significantly improve muscle function, bone strength, and overall well-being. Must-take supplement for probiotics. Probiotics are live bacteria and yeasts that are beneficial for our health, particularly for digestion and immune function. As we age, our digestive system becomes more prone to issues like constipation, bloating, and imbalance in gut bacteria. Probiotics help restore this balance and are essential for seniors looking to maintain optimal digestive health, strengthen their immune system, and even improve overall mobility and muscle function. While probiotics are commonly associated with gut health, their benefits extend far beyond just digestion, making them a crucial supplement for seniors. Why probiotics are beneficial for seniors. Probiotics play a critical role in maintaining a healthy gut microbiome, which is made up of trillions of bacteria in your intestines. These bacteria help break down food, absorb nutrients, and produce beneficial compounds that support the immune system and overall health. A healthy gut microbiome can also help maintain proper muscle function, as the gut affects nutrient absorption, and poor digestion can lead to deficiencies in vital vitamins and minerals that support muscle health. As we age, the diversity and balance of our gut bacteria can decrease, which may lead to digestive problems such as constipation, gas, and irritable bowel syndrome, IBS. Studies have also shown that imbalances in gut bacteria may contribute to increased inflammation, which can exacerbate muscle weakness, joint pain, and even cognitive decline. By introducing beneficial bacteria through probiotic supplementation, seniors can restore balance to their gut and help improve digestion, muscle health, and immune function. Probiotics are also linked to enhanced immune function, which is essential for seniors who are more vulnerable to infections. They help boost the production of antibodies and promote the activity of immune cells like T lymphocytes and macrophages, which are crucial for fighting off pathogens. As seniors often have a weakened immune response, probiotics can help strengthen immune defenses and reduce the risk of infections like the flu, pneumonia, and gastrointestinal infections. Scientific explanation: the role of probiotics in health. The importance of probiotics in aging has been highlighted in several studies. Research has shown that probiotics help maintain a healthy gut by increasing the number of beneficial bacteria and reducing the growth of harmful microorganisms. A study published in the Journal of Clinical Gastroenterology found that probiotic supplementation was effective in reducing symptoms of irritable bowel syndrome, IBS, including bloating, gas, and constipation, which are common digestive issues in seniors. In addition to improving gut health, probiotics have been linked to reduced inflammation and improved muscle function. Inflammation is a significant factor in muscle weakness and joint pain, and probiotics help lower the levels of inflammatory markers in the body. A study in the American Journal of Clinical Nutrition found that probiotics reduced C-reactive protein, CRP, a biomarker for inflammation in seniors. This reduction in inflammation can help prevent conditions such as rheumatoid arthritis, osteoarthritis, and muscle degeneration that affect mobility. Another important aspect of probiotics is their role in nutrient absorption. The gut microbiome plays a crucial role in breaking down food and absorbing nutrients like vitamin D, calcium, magnesium, and B vitamins, all of which are vital for maintaining bone and muscle health. Probiotics can help improve the absorption of these essential nutrients, reducing the risk of deficiencies and promoting stronger muscles and bones. How probiotics support leg strength and mobility. Leg strength is directly linked to muscle function, which can be significantly impacted by digestive health. By improving gut function, probiotics help ensure that the body is getting the nutrients it needs for muscle repair and growth. This is particularly important for seniors who may experience muscle loss, sarcopenia, and reduced strength over time. Probiotics also help support gut-brain communication, which plays a key role in coordinating muscle movement. The gut microbiome communicates with the brain via the gut-brain axis, influencing how the body responds to physical activity and exercise. Maintaining a healthy gut microbiome can improve coordination and motor skills, making it easier to stay active and maintain strength in the legs. Moreover, probiotics help regulate blood sugar levels. High blood sugar can lead to muscle degradation and weakness, particularly in individuals with diabetes. By supporting healthy blood sugar levels, probiotics can help reduce the risk of muscle loss and improve muscle strength, especially in the legs. Pratiquez tips for probiotic consumption. Incorporating probiotics into your daily routine can be as simple as adding probiotic-rich foods to your diet or taking supplements. Here are some practical tips to help you get started with probiotics. Probiotic supplements. If you're considering taking probiotics, look for a high-quality supplement that contains multiple strains of beneficial bacteria, such as Lactobacillus, Bifidobacterium, and Saccharomyces boulardii. A daily dose of 5 to 10 billion CFUs, colony-forming units, is typically recommended for seniors, but it's always a good idea to consult with your healthcare provider to determine the right dosage for your needs. Probiotic-rich foods. You can also get probiotics from natural food sources. Fermented foods like yogurt, kefir, kimchi, sauerkraut, and miso are all excellent sources of probiotics. Incorporate these foods into your meals to help support your gut health. Prebiotics for gut health. In addition to probiotics, prebiotics are important for gut health. Prebiotics are types of fiber that feed beneficial bacteria in your gut, helping them thrive. Foods like bananas, garlic, onions, asparagus, and artichokes are great sources of prebiotics. Pairing prebiotics with probiotics can help enhance the effectiveness of probiotics in your digestive system. Monitor your gut health. If you experience digestive discomfort, such as bloating, constipation, or irregular bowel movements, it might be time to consider adding probiotics to your diet. Regular visits to your healthcare provider can help assess your gut health and determine the right type of probiotic for you. Risks of excessive probiotic intake. While probiotics are generally safe for most people, taking them in excessive amounts can sometimes cause digestive issues, including gas, bloating, or diarrhea. It's important to start with a lower dose and gradually increase it as your body adjusts. Always consult with a healthcare provider before starting a new supplement, especially if you have underlying health conditions or are taking medications. Probiotics can interact with certain medications, particularly immunosuppressants, so it's important to check with your doctor if you're on medication or have a weakened immune system. By incorporating probiotics into your routine, you can improve gut health, support muscle strength, and promote overall well-being, ensuring better leg strength, mobility, and vitality as you age. Conclusion: maintaining your health as you age doesn't have to be complicated. By incorporating the right supplements like vitamin D, omega-3 fatty acids, magnesium, and probiotics, you can support your bone health, heart function, muscle strength, and overall well-being. These supplements are a simple yet powerful way to stay strong and independent as you get older. Always remember to consult with your healthcare provider before starting any new supplement regimen to ensure it's the right fit for your needs. If you found this video helpful, be sure to like, subscribe, and click the notification bell for more health advice. Share your experiences with supplements in the comments, and let us know what topics you'd like to see next. Stay healthy, stay strong, and enjoy every moment of your journey.